Good afternoon, everybody. I guess in some places it may be morning for you. My name is Larry Hoffheimer. I am the chairman and founder of the Macular Degeneration Association. Our goal is to educate as many people as we can regarding different eye conditions, particularly macular degeneration. We're pleased to produce these programs, and I want to thank our sponsors that have assisted in helping to fund them, including Regeneron Pharmaceuticals, Novartis Pharmaceuticals, and Nodal Vision for sponsoring these programs. I'd like you to also check our website, Macular Hope, one word, macularhope.org, for future seminars on different eye conditions, particularly focused on macular degeneration. My interest in forming this organization about 15 years ago grew out of my experience with my late mother, who over 20 years ago suffered wet macular degeneration, which she had no clue that it was a eye disease, and made numerous trips to optometrists thinking she needed new glasses. Finally, when it was diagnosed, the treatments available really were nothing like they were today. So anyway, that gave me the stimulus and the interest in this, and being a retired healthcare attorney, spending my career in Washington, D.C., I wanted to do something for patients with different eye problems to be better educated. So that's where we are. We're a 501c3 charitable organization, and we receive donations and support both from industry and the general public. Our topic today is blepharitis, which some of you may not even have heard of, but it can be a very nasty, thorny condition, and you're going to hear a lot about how you can treat it and deal with it. Our speaker is Mile Brujic. He is an optometrist, graduated from the New England College of Optometry in 2002. He practices a full scope of optometry with an emphasis on ocular disease management. Dr. Brujic is on the editorial board for a number of optometric publications, both nationally and internationally. He's on contemporary topics of eye care. He is a member of the American Optometric Association, the American Academy of Optometry, and enjoys spending time with his wife, Sonia, and his daughters, Zoe and Ava. It's now my distinct pleasure to introduce to you Dr. Brujic.
Larry, thank you. Thank you, and really appreciate the invitation to be here today. I think the philosophy of your organization is very similar to my own. And I feel that the more knowledgeable a person is regarding their condition, the better they are to make the best treatment options and decision options, not only for themselves, but also for the ones they care for the most. Some of you on the call today may have this condition, blepharitis. Some of you may have been described this condition, blepharitis. Some of you may be married or have a spouse or a significant other with blepharitis. And others of you may just know individuals that you've kind of heard of. And there's a deep sense of frustration when the condition isn't treated appropriately. And there's a massive amount of relief that's available for individuals when the appropriate treatment is put in place. And oftentimes that treatment plan really involves you, the patient, and the eye care provider. So what I'm going to be sharing with you today is really some larger generalities about the condition, not only how to diagnose it and how to understand if you or somebody has it, but in addition to that, what the treatment options are and what those are available. I do want to make sure that I emphasize the fact that I'm one that feels that interaction and question and answers are oftentimes the best way to really get to the source of what you may be kind of thinking about, wanting to know about this condition. So if there's anything that comes up throughout the discussion where you feel like, I didn't really follow exactly what he meant through this section, or I really wish he would have described this a little bit more, or I don't necessarily know what term he meant here, make sure you pop it into the question answer box. At the end of the discussion, I've reserved plenty of time for the ability to answer these questions and answers. And we'll make sure that before you leave today, any questions you do have about this, they will get answered if they don't get answered through the presentation. Blepharitis is an interesting condition. When you think about anything where you see the term itis after it, you're always thinking about something that's associated with inflammation. It's interesting, the last year has certainly presented some challenges, but I think it's given us a new appreciation for this term inflammation, because a lot of individuals, a lot of people are talking about it. And although we didn't talk about it in kind of the general population, because of COVID, we discussed it and talked about it a lot. Now, I do think before we get started, it is so hyper important to understand the difference between inflammation and infection, because oftentimes these two terms, although they sound very similar, they mean two very different things, although they can sometimes be associated with one another. So let's make sure that we identify this before we get started with this discussion, because when we use the term inflammation or infection, they both mean two different identifiable things. So let's start with inflammation. What does inflammation mean? Well, inflammation is kind of, you can think of it almost best as a tissue that's warm, hot, sensitive to the touch. So think about, for example, if you've ever had a sore elbow or a sore back. You don't have an infection in that body part. You don't have a bug that's infecting you that's causing that. You just simply have inflammation. You have a body part that's sore, and you know that that body part's sore, but it's not caused by a bug getting into the tissue and causing that soreness. So inflammation is literally nothing more than describing heat, sensitivity to a tissue. Infection is something that's very, very different. Infection is when something gets into your body that's not supposed to be there and starts invading your body. So if you've ever had a sinus infection, that's where a bacteria will get into your sinuses and infect them. If you ever get a cut, the reason why it's so important to clean that cut out and make sure that it's hygienic before you put that bandage on it is because we want the elimination of any bacteria or bugs that aren't supposed to be there out of that wound, which is why we want that wound clean. So infection is when you have a bacteria or something that's not supposed to be in the body invading the body. So again, to summarize, inflammation is when you have warmth, heat, tissue sensitivity, whatever tissue of the body you're talking about. Infection is when you have something that's invaded your body tissues that's not supposed to be there. Now, here's where it starts to get a little tricky. When you have an infection, so a bug that gets into your body and causes some type of unwanted situation, you can have inflammation that's associated with it. Meaning, if I got a cut on my hand and I just left that cut open and a bacteria got in there and it infected it, that tissue would then also become inflamed. So it's infected and it's inflamed. Again, saying that if I have a sore elbow, I have inflammation, but I don't necessarily have an infection. This is going to be hypercritical to understand when it comes to understanding blepharitis, because one of the things that most people don't really understand or realize, because we don't think about it very much when we're not in healthcare, is that our bodies are coated with a thin layer of bacteria. So every single one of us, regardless of how well you think you can clean and wash your hands, if you take your hand right after you clean it and you wipe it on a petri dish, you'll actually grow bacteria. It's virtually impossible to eliminate all the bacteria from our body. So in a normal individual, we have just a thin layer of bacteria that resides all over our whole body. And our eyes and our eyelids are not immune to this. Our eyelids actually have this same thin layer of bacteria that resides over it. It's when that thin layer of bacteria overpopulates. Something happens with the eyelids that actually disrupt the natural balance of bacteria that normally is on the surface of your eyelids, and it causes that bacteria to overpopulate. And when that bacteria overpopulates, it can cause infection and it can cause inflammation. And that's really where we start the discussion here today. Because again, if you have blepharitis, you understand and you know some of the challenges that exist with managing it. There are things and there's homework that you have to do and have to make sure you're doing to manage the condition. But there's also now new treatments that we have available that can actually help alleviate or ameliorate a lot of those symptoms. Now, whenever we talk about how we diagnose a condition in the eye, I think it's always so important to take a step back and understand what normal looks like. Because before we can really have a true respect and appreciation for what abnormality looks like, we need to understand what the normal tissue looks like and how it functions. And in a normal individual, the eye is nice and white and quiet. So the conjunctiva, or the white part of the eye, is very, very white and quiet. And you oftentimes can see some blood vessels in that tissue, but there's not a significant amount of blood vessels that you can see in the white part of the tissue. And your upper and lower eyelids are usually absent of any deposits, any redness, or any irritation. It's pretty interesting. I'm going to share with you a few things about the eyes that you may know and a few things about the eyes that you may not know. The eyelids are there for a reason. They're there to protect us. And what they're there to do is to sweep a fresh set of tears over the eyes every single time we blink. It's interesting. If you've ever run into a situation where you're looking at something and you feel like, for example, the computer screen right now, if you feel like, gosh, this is difficult to focus, and you feel like you just need to really close your eyes and rub your eyes and relax, and then open your eyes again to see the computer screen or to refocus. Part of the reason for that may be because of the tear film that's supposed to sit in a nice thin layer on the surface of the eye isn't sitting in that nice thin continuous layer. There may be dry spots that are forming in that tear layer. Now, what's interesting is the system. Our eyes have evolved to sweep that smooth layer of tears over the surface of the eyes. And the way we do that is with the blink. And when we blink, interestingly, although if I was to ask you, how do we blink? Well, you would think, well, the upper eyelid goes down and the lower eyelid goes up, and then they separate. 95% of the blink is comprised of the upper eyelid sweeping down. Only about 5% of the blink is actually comprised of that lower eyelid moving up. And when you look at yourself or somebody else that you know blinking, you'll see it very, very easily. The upper eyelid drops and it opens up, but that lower eyelid barely moves. If there's anything that disrupts the health of the eyes or the eyelid, it can disrupt the tear film. So when you're talking about a normal situation, you're talking about no excessive bacteria on the upper or lower lids, no redness of the upper or lower lids, and the white part of the eye is typically nice and white and quiet, and an individual blinks about once every 7 to 10 seconds, and there's no disruption to the vision. The vision is nice and consistent. If you get an overpopulation of bacteria on the eyelids, it can cause the eyelids to become inflamed. And that inflammation can cause redness. It can cause the misdirection of eyelashes. So you can see in this individual, the eyelashes are always, in a normal individual, pointing away from their eyes. If you have blepharitis and you have it for long enough without it being treated, you can actually get the misdirection of lashes, and you can actually get it pointing towards the surface of your eye. What this can do is this can actually scrape the eye as you blink. So again, that chronic inflammation can cause the misdirection of lashes. It can also cause the deposits that can sometimes accumulate in lashes. I'm going to show you what that looks like in just a few minutes here. So the other thing that you can see that's healthy and normal in this individual is they very, very easily can keep their eyes open. Oftentimes, blepharitis patients, depending on the severity or depending on the amount of inflammation in the eyelids, they sometimes almost have what I call a squinty-eyed appearance. They almost have a difficult time keeping their eyes open, and sometimes they can even be sensitive to lights. And the reason why that occurs is because if the blepharitis and the bacterial overpopulation is bad enough, it can actually affect the corneum, which is the clear structure that resides right over or on top of the colored part of the eye. So what is blepharitis by definition? Well, it's an inflammation of the lids in which they become red, irritated, and itchy with dandruff-like scales that form on the eyelashes. Now, that's really just the beginning of this, because what I'm going to share with you after the discussion here, after the PowerPoint, I'm going to share with you how the normal eye functions and produces tears and how critically important blepharitis and managing blepharitis is to this whole process. So you may be asking yourself if you have blepharitis or if you know somebody who has blepharitis. Well, why does this occur? You know, the number one question I get from patients is, in particular, when I tell them that they have a bacterial overpopulation on the eyelids, they ask, well, do I have an infection? Kind of, but not quite. Let me explain to you why I say that. Blepharitis is an overpopulation of the bacteria that are normally supposed to be there in low concentration. So remember, I told you earlier that every single one of us, our whole body is covered with a thin layer of bacteria. And under normal circumstances, our body does a really nice job of maintaining that low level of bacteria, because what's interesting is that bacteria that's at low levels on our skin actually helps us as well too. So it doesn't just potentially cause bad things, but it actually helps us defend against other things that may be wanting to get into our bodies. But when the balance is disrupted, the bacteria can overgrow the region or the area. And the eyelids are hyper susceptible to this. And here's why that's the case. The eyelid produces a special oil called meibum. They're produced from the meibomian glands. You don't need to remember that term just yet. We're going to come back to that in just a few minutes here. But what's important to remember is that the eyelids produce a special oil. And this special oil is the oil that the eye naturally produces from its eyelids that keep the bacteria residing in low populations. If there's anything that disrupts the health of the way that the oils are produced at the eyelid, the bacteria then starts to overpopulate. So a lot of times people have a misconception. They say, boy, doc, you showed me this picture of my eyelids and it looks like all this bacteria is at my eyelashes. They say, why is that? Like, did somebody infect me? Did I get this from somebody? And 99.9% of the time, the answer to that question is no. Unfortunately, it's not something that's contagious. The reason why I say unfortunately is because if it was contagious, we would know how to treat it and handle it and manage it very, very quickly and easily. Just find out where it happened, isolate that individual, treat them, and then they can't pass it on to other individuals. Instead, what this is this alteration in the way that the eyes and the eyelids produce those oils that normally hold the bacteria in very, very low concentrations. And one of the major risk factors for this is age. It's time. We see this, interestingly, more so in younger individuals. So we see it in individuals that are 5 to 15 years old pretty frequently. And then what's remarkable is it drops in its prevalence. So we see it much less in the teen years and the 20s. And then in the early to mid 30s, we start to see it creep up again. And as we continue to get older, we start to see it more and more so, or the prevalence increases in the number of patients that we see it. And we think it's inherent changes in these oils that are occurring with our body that can change this and that can make it more difficult to control or contain those bacterial populations. There's another misperception. You know, when I share that a patient has blepharitis, or that's the reason why their eyes are irritated, or why they're seeing the redness, or why they're experiencing the symptoms they are, or why I'm seeing what I am at the slit lamp, there's always a concern that there's kind of an unhygienic component to it. And that's not the case at all. I always assure patients that it's not something or a habit that you're doing. But now that we know you have this, it is something that you're going to have some homework in maintaining. And we're going to talk about what that is and what that looks like in just a few moments. Now, this is a cartoon depiction or representation of what blepharitis looks like. And on the left-hand side of your screen, you can see what that healthy eye looks like. And again, a cartoon depiction of what this looks like. And on the right-hand side, you can see a representation of blepharitis. You can see there's depositing at the base of the lashes that occurs. Sometimes people will even describe a flakiness or excessive matter or discharge that they notice in the morning. Sometimes people will refer to it as sleep, or I have extra sleep in my eyes this morning. Oftentimes what that is a sign or a symptom of blepharitis, and that bacteria just overproducing a lot of the waste products that they do and accumulating in the corners of the eyes in the morning. What's also telling in the picture and what's different between the right and the left side is you can see a little bit more redness in the lid margin in the individual on the right versus the left. Now, what does this look like at our magnifying lenses? So what I'm going to share with you all right now is a view through my special magnifying lenses. So when I look at patients' eyes, this is how an eye doctor actually sees or views the eyelid. And you'll see why we sometimes can see things that you just can't see by looking in a standard mirror. It magnifies things a lot. Now, just to put things into perspective for you, what you're going to be seeing here is I'm asking a patient to close their eyes, and I'm looking right at their lash margin. So that's what you're going to be looking at here. Now, everything might look a little bit overwhelming here because you may not be used to looking at something at this level of magnification. So again, I'm showing you a video, and this video is directly from my slit lamp camera or my magnifying lens camera that we have. And what you can see is there is a lot of small little, it almost seems like little golden nuggets that are at the base of the eyelashes. When I refer to the base of the eyelashes, that's where the eyelash actually enters into the skin. And you can also see some wet or sticky debris there that we just passed by as well too. And you can also even see some things that are further down along the line in the eyelashes. So again, this is one of the ways that we diagnose blepharitis. Now, what I'm going to show you here is the exact same video that I just showed you. The only difference is I took two pictures from that eyelid margin. So again, just to reiterate, and again, if you're not used to looking at pictures like this can potentially be overwhelming, but you're looking at the eyelid margin. I'm asking a patient to close their eyes. And what you're seeing is their eyelashes, and you're also seeing the base of the eyelashes. Now, on the left-hand side, this is what it looks like at a low magnification, but I really want you to focus on the picture on the right-hand side because it's the same patient. The only thing that I did differently here was I magnified the view through my oculars. And what you can see here, and I'm going to show you some of the abnormalities that exist here, is you can see some of this, what I'm going to refer to as just kind of slimy discharge that's right here on this eyelash. And you can also see these bumps that are located right here at the base of the lashes. None of this is normal, and all of this should be absent. In a normal individual, those eyelashes go right into the eyelid skin, and where it goes into the eyelid skin is perfectly flat. So again, we don't like to see any of these bumps at the base of the eyelashes because that indicates bacteria and bacterial byproducts, those kind of waste products that bacteria produce, and they actually accumulate at the base or the part of the eyelash where the eyelash goes into the eyelid. Now, what's interesting here as well too, and again, for the purposes of this discussion, I want to really reacclimate what you're looking at here. So I'm asking a patient to look down. And when I'm asking that patient to look down, I'm pressing on the upper lid. And as I'm pressing on that upper lid, I'm attempting to get the oils out of those small little oil glands. And those small little oil glands are called meibomian glands. Now, this is what it looks like in a video, and you can see my finger even pulling up on the upper eyelid. But I want to show you what this looks like, and I'm just going to take a picture out of that previous video, and I want to show you what this looks like. And what you can see here is, again, the eyelashes, if you're not used to looking at these large magnified views, they look almost overwhelming at this magnification. So this is the underside of the patient's upper lid margin. But see this spot right here? This spot, we typically don't see that little bump in the eyelid margin. What that is a small, tiny little orifice where oil started to come out of that orifice, but because it's so thickened, it just stopped. It stagnated there. And because it's stagnant, you see this big, almost kind of, it looks like a buttery secretion that's present there. This is one of the risk factors or reasons that somebody will develop blepharitis. So this tiny little area here where the oil is not coming out of those glands is one of the things that will cause or be a risk factor for blepharitis. One of the ways that we test to determine and see whether the oils that the eyes are supposed to be producing are normal is we apply pressure to the lower lid. So if you've ever been to the eye doctor and they've ever had you look up and they press along that lower eyelid margin, they're looking and they're assessing what those oils actually look like. And we have a few ways to do it. We sometimes will just do it with our finger, or we have tools like you see here on the right-hand side where we can put a specific defined amount of pressure on that lid margin to see if there's tiny little oils that are coming out of those meibomian glands. So I want you to kind of keep this in the back of your mind and keep this as a nugget, because we're going to come back to this towards the end of the discussion as well too. Now, again, I want to remind all of you, please make sure that you're putting questions in the chat box. I promise you, I will address and answer all of these at the end of the discussion. So if you're hearing me say something that you don't necessarily agree with, you've heard something different, you have questions, or you need clarification on anything that I'm sharing with you, please put those questions in the question answer box and I'll make sure to address those. So now we have this condition and we've identified it and now we understand what it is. So the question now becomes, how do we treat it? How do we make these eyelids better? And how do we rid it of the bacterial overpopulation and also the inflammation? Well, one of the fastest and quickest ways to do this is with an eye drop. Now, there's certain types of eye drops that we use specifically for blepharitis. These have two agents in them that are so critically important to understand. The first is an antibiotic. An antibiotic kills bacteria. So what it will do is it'll reduce the population of bacteria on your eyes. The second ingredient that it has is something referred to as a corticosteroid. For those of you that are unfamiliar with what a corticosteroid is, this is something that reduces inflammation. So for example, if anybody's ever been on oral prednisone, you're probably on oral prednisone for some type of inflammation that's occurring in your body. But you know with oral prednisone, you can only take it usually for a short period of time. And then it reduces the inflammation, and then we take you off of that oral prednisone. Well, for blepharitis, we don't need an oral prednisone, but we only keep you on a corticosteroid or something that can reduce inflammation for a short period of time. So we usually treat you with these drops for about 5 to 7 days. And there's really two that are common in this category. One is Xylit. It has an antibiotic in it, tobramycin, and a corticosteroid in it called loteprednol. And there's a second agent in this class or category called Demodex. This has tobramycin, again, same antibiotic. The only difference is it has a different steroid that's in it. And what I'll typically do with my patients is I'll have them take one of these drops anywhere from 2 to 4 times a day, depending on how bad the blepharitis is. And then, so for those of you that take drops on a regular basis for anything, you know that you take the drop and you keep your eyes closed, and your doctor may have even told you to punctal occlude, which is kind of putting pressure on your nose right where the tears drain into the back of the nose and the throat. Well, we add one thing to this regimen. So if you ever wipe away excessive eye drops, what I tell my patients using these drops is to close their eyes after they place the drops in and rub the drop right into their eyelash margin. So the most medication is getting right to the source where it's required. We sometimes will prescribe ointments for blepharitis. That's more of an exception to the rule. And the reason why I say that is because for anybody that's ever used an ointment for anything, you know that it has deleterious effects to your vision, meaning you put an ointment in, and it may feel comfortable, but you know that your vision is blurry for about the next 20 to 30 minutes. So again, it's sometimes difficult to use ointments during the day effectively, where both of these drops can be utilized and they don't really blur up the vision. So then what we typically do with blepharitis patients, and I'm sharing with you on the phone here all my protocol, I'll actually have the patient with blepharitis back. And what usually happens at that first follow-up visit in about 5 to 7 days is we usually see the blepharitis as substantially improved. Why? Because we're reducing inflammation and we're reducing the number of bacteria that are on the eyelids. What we then do to really make sure that all of the residual bacteria is gone is we have a special instrument where we can clean the lid margins. So what you see here on the left-hand side is something referred to as Blefx. The technical term for this is called Microblepharo exfoliation, but we'll simply refer to it just for ease of purpose or ease of discussion as the Blefx. And what this instrument does, it's interesting. You can all see the top of the instrument right here where there's kind of this small white thing on the end of it. This small white thing is a micrograde surgical sponge. And what we do is we dip that in soap. And then what we do is we clean the eyelid margins with it. It spins really quickly. Now, what you're seeing here on the right-hand side is you're actually seeing a video of me cleaning a patient's lid margin. So again, you can barely see that little white thing because it's spinning so quickly, but we really can get all of the residual bacteria off of the surface of the lid margin by doing this. So after we do that, we have another challenge, because for most patients or most individuals who have blepharitis, if it's chronic in nature, we know that it's going to come back. Now, here's one of the things that's hyper important to understand. You'll hear these terms in healthcare that we use, and two big ones are called acute versus chronic. Well, what's the difference between the two? Acute is something that happens, we treat it, and it goes away. For example, I have a sinus infection. I go to my general physician, he gives me an oral antibiotic, he treats it, and then it goes away. It's not something that I constantly have to be managed for. It was an infection, it was acute, and then he treats it and he goes away. There are some subtypes of blepharitis that we treat once, they go away, we don't have to worry about them anymore. Most forms of blepharitis, to a certain extent, are chronic. And what that means is that unless we manage it, it's going to come back. The symptoms are going to come back. If it's eyelid redness, the symptoms are going to come back. If it's eye grittiness, those symptoms will come back after we finish treatment. So we have to have a way to manage those bacterial populations that are increased in amount, or that reside on the eye and want to reside on the eye at higher than normal levels. So one of the ways that we can do that is with lid scrubs. And lid scrubs, some of you may be even familiar with this. You can go to any pharmacy, you go to the pharmacy shelf, you rip open the package, and it's like kind of this soapy formulation where you actually wipe those scrubs along the eyelids. There's actually newer things that we can now do for the eyes to help maintain them. And usually this is done either once a day or twice a day. The analogy I would give to a patient or somebody with blepharitis is, for the exact same reason that you brush your teeth every day or twice a day, because it's difficult to keep your teeth clean unless you really do brush them. And then when you go to see your dentist every 6 months, they do a more deep cleanse or cleaning of the teeth. That's exactly how we view the lid margin for yourself. So you do have to do something to maintain it. And then what we'll make sure that we're doing is every 6 months when we see you, we're going to do that deep cleaning and that deep cleanse of the lid margin to make sure that we get any type of bacterial population that's coming back away from the lid margin. So one of these kind of newer treatments is something called hypochlorous. Hypochlorous is an interesting molecule because it's actually naturally found in our body. We've heard a lot about immune cells over the last year. Just to give you perspective, before I went to optometry school, I was I studied biology, and my minor was biochemistry with an emphasis on immunology. So this is really where my passion resides. So if I go too deep on some of these topics, please disregard that the information that you don't want. But hopefully this even helps you understand immunology a little bit better. So whenever you have an infection or something that's overpopulating the body, or if you have an infection of any sort, your body is trying to fight the infection. And the way they do that is they bring immune cells to the area. And one of the ways they try and kill the extra bacteria that's in the region is they have these cells called neutrophils. And these neutrophils actually produce hypochlorous acid to try and kill those bacteria. So this molecule is an essential part of our immune system because it kills bacteria or microorganisms that aren't supposed to be in our body. It neutralizes stuff that will irritate our skin, and it's actually anti-inflammatory in nature. Again, remember what inflammation is. So I am one that has very sensitive skin. So when I shave in the morning, oftentimes my neck is very sensitive. I actually spray hypochlorous on my neck to actually soothe it because of the strong anti-inflammatory properties that it has. And there are a number of brands that are out there or available. Avenova is one that's a prescription strength. High Clear is one that you can actually get from eye care practitioners' offices. And all of these other ones, Hypochlor, Therateer, Sterilid, Bruder Hygienic Eyelid Solution, and a Hydrate lid and lash cleanser, you can either get through eye doctors' offices or online or at pharmacies. I have to share with you one other thing, and one other major cause for blepharitis is something called Demodex. Now, some of you may have heard of this word Demodex or Demodex blepharitis. And for those of you that have pets, you may have heard of your veterinarian talking about a Demodex infestation of the hair follicles somewhere on your dog or your pet's body. Interestingly, this is a small, tiny mite that almost everybody, by the time we're 70 years old, we can actually culture Demodex in almost every single eyelid or eyelash. So we can see it in the hair follicles. The interesting thing is, just like bacteria in normal patients or in individuals who don't have blepharitis, they have it in very, very low concentrations on the lid margin. So it doesn't cause any type of issues for most individuals or most patients. When it overpopulates, it can cause significant itching and redness, very similar to bacterial overpopulation. What's interesting is, as of right now, we only have one way to treat Demodex blepharitis, and it's not through an antibiotic, but it's through tea tree oil. And tea tree oil, it's the Melaleuca oil that we're really interested in, or what has the therapeutic effect. And it's actually found in or native to Southeast Queensland and Northeast coast of New South Wales, Australia. It's not something that's meant to be ingested, but it is something that in high concentrations, it's remarkable. It works very, very well at lowering populations of Demodex on the eyes. And the way that you use it, it's in a white form, and you just apply it to the lid margin for about 10 seconds. For those of you that have ever used any type of shampoos or anything like that with tea tree oil in it, you know that it tends to burn the scalp just a little bit. It's kind of the way that you know that it's working. The ocular formulations are much more mild than what you find in shampoos, but in that same vein, it is important to make sure that it's dry before you open your eyes. Otherwise, you may feel a little bit of stinging that's occurring. So you want to make sure that the lids are closed. And what I sometimes even tell patients is just fan dry it. Just have like a book or something or a newspaper available to fan dry your eyes before you open them, and that'll help with the comfort of the tea tree oil around the lid margins. And just as a kind of an interesting FYI as well too, for those of you that have been diagnosed with Demodex blepharitis and are currently undergoing treatment, there's nothing that's FDA approved for Demodex blepharitis, but the first eye drop is going through clinical trials, and the original or the initial results that have been posted on the National Eye Institute website show very, very promising results. And it looks like we will, in the near future, in the next few years, have something that's available as a prescription drop to treat Demodex blepharitis. So a few things before I take the question and answers here that I want to go over. I talked a little bit about those oils that are produced along the lid margin. Now, For those of you that don't have me in kind of your large view, just make sure that you have me highlighted so you can see what I'm showing you here. Now, this is my eyelid model. Now, this is an abnormal eyelid model. So if you can picture this being your lower eyelid, and then you can picture taking a cross section of the eyelid, you can see the skin on the front, and you can see what we call the palpebral conjunctiva on the back. So this back surface of the eyelid is usually what resides up against the globe or the eyeball itself. Now, the reason I'm showing you this cross section of the lid is this right here. And everybody can see this small little region right here, this kind of brownish region. This is actually something that's referred to as the meibomian gland. And the meibomian gland actually traverses through the eyelid, and you have them in your upper and lower eyelids. And you have a whole bunch of them running all through your eyelid, all through your eyelid. You have a bunch of them. Think of them kind of as like toothpaste tubes, almost running up and down your upper and your lower lid. This brown region right here is that gland. And this gland right here normally produces oils that look like vegetable oil. And what it usually does is it produces oils that look like vegetable oil that come out on your eyelid margin. So you can see where your lashes are right here. And this is your eyelid margin. They usually come out right here where you see these small little white spots. These white spots are actually representative of what we refer to as capped glands. This is something that can be caused secondary to blepharitis. This can also be caused by something referred to as meibomian gland dysfunction. Meibomian gland dysfunction is when these oils are produced too thick. They look buttery instead of looking like vegetable oil. And then they literally clog up the small little holes where they're supposed to be coming out of the eyes. And then it promotes the production of more bacteria on the eyelid margin, causing redness as well, too. All right, so we see some questions coming in here. So I'm going to get to these. And the first one we have here is, will washing my eyelids with baby shampoo help? So certainly washing your eyelids with baby shampoo can help. And let me be very specific on this. So what we were taught in optometry school is baby shampoo can help, but first and foremost, you want to dilute the baby shampoo. And by diluting the baby shampoo, you want to take 1 part baby shampoo, 5 parts water. You want to make sure that it's mixed up. And then what you want to do, the best case scenario, is you want to take that mixture, you want to apply it to a Q-tip or a cotton tip applicator and rub it along the lash margin so that you're physically abrading and cleaning the debris off the base of the lashes. Now, saying that, for most individuals, this is a very, very difficult task. And some more recent or contemporary research has actually demonstrated that some of the shampoo, some of the oils in the shampoo can actually clog or congest some of the glands that we have around those delicate eyelid margins. So we've really kind of strayed away from that recommendation with some of the more active approaches that we have. And it's certainly best to really consult with your eye care practitioner to figure out what's best for you. Because again, your condition may be mild enough that just baby shampoo diluted to that level may be appropriate and enough for you. You may need something that's stronger, and that's where they can guide you. Okay. I had a question come in, and I'll read these out loud to make sure that everybody's hearing the questions. Can macular degeneration cause blepharitis? My eyelids are itchy and sometimes are sticky. So the fortunate answer to that question is no. Those two are separated. And I want to make sure you really understand why that's the case. So this is my eye model right here, okay? So, normally what you see in the eye here is the upper lid and the lower lid, and you only see a little piece of the eye. Now I'm going to strip away that upper eyelid, and we're taking the top part of the eye away, and now I'm giving you a look inside of the eye. And when you look inside of the eye, you can actually see a small little region right here called the macula. That's where macular degeneration occurs, and that's where all the light goes in through the front of the eye and focuses in on the back of the eye. So that's macular degeneration. It's all involved in the back of the eye. Blepharitis involves the front of the eye. So it involves the eyelid. So these two things, although you can have both conditions, They're fortunately both unrelated. So if you feel like, oh my gosh, my macular degeneration seems like it's worsening, don't think that it's going to affect your blepharitis. Or in that same vein, my blepharitis is getting worse. I wonder if that's going to affect my macular degeneration. Neither of those statements are true. Both of those are independent of one another. Okay. Next question here. I suffer from dry eye and notice that my eyelids are now red and irritated. That is an exceptional question. And what's interesting is a lot of times this is the way patients will present. They won't present necessarily with itchy, irritated eyelids at first. They'll present with eye dryness issues that we'll actually figure out are because of the underlying blepharitis. So I think it's important for you to communicate with your eye doctor on this, because it is critical to determine whether or not the eyelids are actually causing the dryness. We've had a number of patients where we've treated the eyelids and they've said, oh, by the way, doc, my eyes feel a lot less dry. And for some individuals, we've actually been able to take them off of some of the prescription dry eye medications that they've been on. So again, make sure you communicate that and ask your eye doctor about that. Okay, next question. What about adding oil to the eyes, like castor oil? So there are safe ways to add oils to the eyes. Now, my philosophy, before I give you the answer to this, is very, very simple. My philosophy is, let's take what your body's doing inappropriately or inadequately, and let's see if we can make it produce more healthy oils. One of the ways we can actually do that are now with active treatments in the office. So for example, if you've ever used a warm compress on your eyes, where you take a warm washcloth, heat it, and rest it on your eyes, you know immediately that makes your eyes feel better because they're closed and there's nice warmth on it. You can also, as well, too, in addition to putting a warm washcloth, there's easier ways to deliver heat to the eyes. There's heat packs that you literally put in a microwave for about 15 to 20 seconds. Then you rest on your eyes for about 5 minutes. And that takes the oils that are in these tiny glands and it attempts to melt those oils. And when it melts those oils, just like putting butter in a frying pan, melts that butter and takes it from that stiff oil and makes it look more like a vegetable oil, we can do the same thing with the oils coming out of the meibomian glands. So we attempt to warm them at safe temperatures in a controlled manner and placing it on the eyes. And it can, in some individuals, melt those oils and produce them so they look more like vegetable oil. Sometimes that's not enough because the oils can get really congested in that gland. So we actually have other treatments that are available. There's something called LipiFlow, there's something called iLux, and there's something actually called Tear Care, where you literally take these small little applicators, and in a doctor's office, we place them on your eyes. They're on your eyes for about 10 minutes. They put the exact amount of heat to melt the oils on your lids. And then what we do is we have a special device where we can evacuate those glands and get all of the thickened oils out of the eyes. Now, if we feel like we need to supplement the eyes with additional oils, we're fortunate that we have artificial tears that have these oils that are available in them. So if you've ever seen an eye drop called Systane Complete, that actually has these oils in it. If you've ever seen a drop called Soothe or Soothe XP, this drop has those oils in it. If you've ever seen a drop called Mega 3 drop from Allergan, those have these oils in them. So there are things that you can use over the counter that naturally have these oils. Great questions. Okay, next question. I wake up in the morning with sand in my eyes. Why is this happening? One, stop sleeping on the beach. No, do not stop sleeping on the beach. Sleeping on the beach is therapeutic. So I think what you mean, or I think what you're referring to is it feels like there's kind of little nuggets almost in the corners of your eyes. This is one of the most common symptoms that we see with patients with blepharitis. I'm going to give you a few things that you can try at home. And if you still experience those kind of sand nuggets in your eyes, I recommend you have a conversation with your eye doctor. So what that usually means is whatever is accumulating on your eyes throughout the day isn't getting washed off in the evening. So at night, I mean, think about what's happening in the evening. We close our eyes, and we're closing our eyes anywhere from 4 to 8 hours, depending on how long we sleep. Well, could even be longer than 8 hours, but for me, it's oftentimes shorter than 8 hours. But we close our eyes, and as we close our eyes, we provide this moisture-rich environment for bacteria to flourish. So we close our eyes, and those bacteria in there love to replicate, love to replicate, love to replicate. It's one of the reasons why, too, you might even feel like, some mornings I notice it more than others. Because if you've had a day where you've shook a lot of hands, remember when we used to shake hands, or just kind of been working in more adverse environments, you may be exposed to more stuff that gets on the lids. And if we don't wash our faces adequately in the evening, you may notice that in the morning. So that's step one. Just make sure before you go to sleep, make sure you're washing your hands, make sure you're washing your eyes appropriately. If that doesn't help out, make sure you're communicating with your eye doctor about that. All right, next question. I was told to use warm compresses on my eyes and it doesn't seem to help. What else can I do? Oh, this is good because this piggybacks on exactly what we were talking about. So again, the idea with warming or putting warm compresses on the eyes is we're trying to put heat on the eyelid. And here's the challenge. So take a look at where these meibomian glands are. These meibomian glands are located closer to the back side of the lid than they are on the front side of the lid. So because of that, just regular heat placed on the eye, it's difficult to get the heat all the way through the eye. Now, saying that, if you try just regular warm compresses, like you're just taking kind of a towel and making it warm and then putting it on the eye, that's difficult to use. You don't know what temperature to set it at. It always cools off pretty quickly. Make sure you're communicating with your eye doctor about the right warm compress to use, because they may even have something in their office that's of professional grade, and they know, like, you put it in the microwave for this long and it's going to be at this temperature, and that's your best chance of melting those oils. If you don't get those oils melted, there are special procedures that we can do in the office. And the great part about these procedures, when we normally talk about eye procedures, everybody gets a little bit concerned. They say, oh boy, this is going to hurt, this is going to be painful, I don't like stuff around my eyes. 99% of our patients that go through this procedure actually say they love it and it's comfortable. So again, you put an applicator on the upper and lower lids, and then what we do is we evacuate the glands with a special tool. And when we do that, we can get all those fresh or those stagnant oils out, and your body starts producing those natural oils again. So make sure you have the conversation with your eye care provider about the right warm compresses to use, and make sure you're asking about those procedures that may be available and may be able to help you as well. Do I need to throw out my eye makeup? So that's a good question, and it depends. So if you have an active infection on the eyes, you don't need to throw away your makeup. If you have a if you have an acute infection of your eyes, you do need to throw your makeup away. If you have a chronic blepharitis on your eyes, you don't need to throw your makeup away, but you do need to make sure that you're cleaning your eyes really, really well in the evening. Makeup, in my personal opinion, is one of those things that I think in the background kind of makes blepharitis, or can make blepharitis worse, in particular if you're not doing or not appropriately cleaning your lids in the evening after you take the makeup off. Okay, next question here. I have lupus and have a lot of trouble with my eyes. I experienced many infections, eyelid pain, and my eyes are extremely red. What should I be doing to help my eyes? So fortunately or unfortunately, I see a lot of patients with your presentation. It's very, very common. As you're well aware, and just for the benefit of everybody else on the call, lupus is an autoimmune condition. Autoimmunity, just so everybody's clear on what this is, it's a condition where your body's immune system recognizes part of your own body as foreign and starts attacking it. And that's why you get inflammation. So if you've ever heard of irritable bowel syndrome, that's where your bowels actually get irritated because there's an immune response to it. If you have rheumatoid arthritis, that's an autoimmune condition where your immune system is acting against it. And lupus isn't an exception to that rule. So it's very common to see dry eye associated with this. it is so hyper important for you to have a good, close conversation with your eye doctor about this, because you do have options. And with lupus, it really depends on what's the source of the redness and irritation. If it's blepharitis, there's adequate ways to fix it. If it's those oils being inadequately produced, there's good ways to fix that. If it's just a generalized diffuse inflammation on the eyes, there's good ways to fix that. So to answer your question, there are ways to help you, but it is important that you have a really close conversation with your eye care provider and really let them know exactly what you're looking to accomplish. Because oftentimes, in the time that we're in the exam room with you, we really need to make sure we understand how much the condition that you have is bothering you. So make sure you express that, because there are appropriate treatments for you. Can dust or animal dander cause blepharitis? You know, dust and animal dander can aggravate it and irritate it. And where I see a lot of the tough stuff with dust and animal dander is you can have an allergic response to it. An allergic response causes itching to the eyelids. So just putting your fingers around your eyes and itching can actually cause blepharitis. And now you can cause your eyelid skin to get dry and itchy and irritated. So it can secondarily cause blepharitis. One of the things that I would recommend is if you do have any type of allergic issues to animal dander, dust, or anything like that, where you're constantly feeling like the inside corners of your eyes get itchy, make sure you're using an adequate antihistamine eye drop. Those are available over the counter now. And there's several options available. Zaditor, Aloe, and Pataday is available over the counter. All of those used to be prescription products, and now they're available over the counter. So make sure you try that first if you have an allergic issue. And then if you're still having issues, make sure you see or consult your eye care provider. Okay. Is the tea tree oil sterile, or is that not an issue? Great question, and I'm glad you're clarifying this. The tea tree oil is sterile. So the tea tree oil, it's actually found in tiny little packets like this, and they're in these small little packages where you open it up, and the tea tree oil is actually soaked into these small little cloths. So again, it is sterile. It is very controlled in the way you place it on the eyes as well, too. And the largest company that distributes tea tree oil wipes is something called Clearadex. And make sure that you're communicating with your eye care provider about it, because again, if you're using it and it's not appropriate for you, you won't see any benefits. So it is appropriate. It is important to have that conversation with your eye care provider. Okay, next question. My eyes burn and feel gritty. Is this blepharitis? It can be. One of the most important things when you have eye discomfort is to communicate that with your eye care provider. They have the tools and technologies to determine what the underlying cause is for you, and they'll make sure that they get you on the appropriate treatment path. Again, there's so many things that can cause eyes to feel dry and gritty. Blepharitis certainly is one of those things that is on our differential diagnosis, but there are several other things that can cause that as well too. And again, a good relationship with your eye care provider is the most important thing in identifying that. All right, next question. My eyes are constantly tearing. They burn and the lids itch. Could this be an infection or blepharitis? It could be. Now, saying that, if you were presenting to my office, I don't know what your eyelids look like at all, but if you're saying my eyelids or my eyes are tearing, they're burning, and they're itching, the first thing that I would think about is that sounds a lot like ocular allergies. Now, if it's not ocular allergies, then yeah, it could definitely be blepharitis. And blepharitis is kind of a subacute infection, in particular when you're talking about those chronic cases. We see individuals, new patients in the practice that have had this condition for decades, and they just didn't know, and they kind of just lived with these uncomfortable eyes. And then when we cleaned up the lid margin, we found that they did remarkably better. So again, it could be, but so important to make sure that you're asking your eye care provider and communicating with them about this. All right, the next question. I notice little red bumps on the bottom of my eyelid where the lashes come out. What is this and why am I experiencing this? So the most likely cause of these tiny red bumps are something referred to as hordeolum. Now, hordeolum is just a technical term for what we typically refer to as a sty. What a sty is when an oil gland gets clogged up. Now, there's two types of styes. There's a sty that can happen on the inside of the lid margin, and there's a sty that can happen on the outside of the lid margin. When it happens on the outside of the lid margin, it almost looks like a little pimple that's right at the base of your eyelash. So when you look closely at yourself in the mirror, you'll actually see the red right around the base of the eyelash. An internal sty or an internal hordeolum is something where when you, so this is the front of a lid margin, when you pull your lower lid down, you'll actually see something that's kind of white on the inside of your eyelid. And that's where one of those inside of the eye glands is clogged and congested. So the reason that you're likely having this, and again, I preface everything that I say by make sure you're communicating with an eye care provider, but the reason why you're most likely having this and would be at the top of my differential diagnosis is those glands that we talked about that normally produce vegetable oil-like glands on the surface of the eye every time we blink. These glands can get clogged. And when they get clogged, two things happen. One, you're not producing enough oils, but two, if you're not constantly, so if the body's not constantly clearing these glands out with fresh oils or these kind of more fluid liquidy oils, they can get stagnant. And when they get stagnant, it's easier for bacteria to get in there. And when bacteria get in there, you can get an infection of those glands. And that's where those styes actually come from. Okay, great questions. Great questions. Okay, I use eyelash scrubs now, but it seems to irritate my eyelids. Is there anything else that I could use or do? There certainly is. So if eyelid scrubs are irritating your eyelids, that's actually performing the exact opposite function that I think you're interested in performing. So sometimes these lid scrubs, they have these ingredients that we become allergic to, or we may have a sensitivity to. So one of the best ways to do that is to eliminate the offending agents. So the easiest thing to do, if you feel like, man, my wipes were working well, and then all of a sudden they stopped working, they started irritating my eyes, try another wipe, because that other or the second wipe may just be absent of whatever you're allergic to. One of the other things is, remember when I success with this. So the way that this works is you spray hypochlorous on your eye, and you can either spray it on your eye with your eyelid closed or your eyelid or your eyes open. And then what you do is you close your eyes, and with a clean finger or with a tissue, you just rub it into the lash margin. And we found remarkable success, and it keeps those bacterial populations at manageable levels. I suffer with dry skin, and notice that it's affecting my eyelids. Is this blepharitis? Potentially, it can be, but it sounds like it's secondary to some type of other more systemic skin issue. First thing I would do is, one, as an eye doctor, I can treat you locally, but I think you're best served initially to have a dermatological consultation. So find out why the skin is dry, because sometimes it's just I need to drink more water, or I need to put more moisturizer on my skin. If it's something that's more serious, they can treat you appropriately. Sometimes with dry skin, that can be associated with either the medications that you're taking systemically for other conditions, or it can be associated with some type of autoimmune condition. So making sure that that's being cared for appropriately is step one. To ameliorate some of these symptoms, we can treat it locally, but again, we always refer to dermatology when we see that. Whenever I see dry skin on the lids, I always ask about dry skin or dry patches anywhere else on the body. And if there are dry skin patches in other places in the body, we always do a dermatological or a referral to a dermatologist as well, so that they can actually get to the underlying issue if there is one. Okay, next question. What doctor should I see for this condition? I think I answered that question. So if it's specifically to the eyes and you really don't have any other issues, dermatology. Or if you only have eye issues, an optometrist. If you have both of them, you'll probably need to be under the care of both a dermatologist and an optometrist, because oftentimes even systemic treatment oftentimes leaves the eyes a little underwhelmed. Like sometimes you still need additional treatment for the eyes as well. All right. Can the environment cause blepharitis? Yeah, it certainly can. And it can exacerbate blepharitis. There are certain forms of blepharitis that are exacerbated with temperature change. There are certain forms of blepharitis that are exacerbated by allergic eye disease. So to answer your question, it can cause the condition, and it can actually make it worse as well too. So if you feel like, yeah, I do feel that this is worse in certain environments, make sure that you're communicating with your eye care provider, because they'll guard you and give you the best solutions for whatever environment you find yourself in. Okay, here's another question here. I have a friend who is told her swelling on her eye is due to a swollen oil gland. She was advised to use warm compresses for 2 weeks. If the swelling does not go down, she was told she could have surgery in the eye doctor's office. Is that a procedure like you just mentioned, the surgery they told her about? Not quite. And Teresa, I'm glad you're asking for the clarification on that. Again, as important as these types of forums are to get you information, it's just as important to add clarity and clarification to this, because again, you'll start talking to people and you'll start kind of remembering some of the things we talked about, and they'll start to sound similar. It's so critical to you that you differentiate these things as well too, even in your mind, because it'll empower you as well to if you ever experience these symptoms. And just as an FYI, we are over an hour. We'll be here for about another, so it's about an hour and 10 minutes right now. We'll be here for about another 15 minutes or so, available for questions. So again, if anybody has any questions, feel free to enter those into the chat box. So Teresa asked, to answer your question specifically, what your friend probably has is something called an internal hordeolum. Now, again, I can't answer specifically or definitively, but I can answer with a certain level of probability that it sounds like an internal hordeolum or a stye on the inside of the eye. Now, a stye on the inside of the eye is caused by this little gland right here, which sounds like the oil gland that was clogged, gets clogged up with bacteria. The purpose or the intent of heat is to melt that oil gland so that the infection releases itself from that gland. Now, what sometimes will happen is when somebody has an infection like that, if it doesn't get emptied out with heat appropriately, it forms something called a chalazion. A chalazion is literally nothing more than one of these small, tiny little glands that's swollen up, and the contents were never released, and they just hardened up. And because they hardened up, you can't unharden them. You can try with heat, but if it doesn't work with heat, the only way to do this is to literally avert the lid. So you're flipping the lid down, you cut, and then you take that small little, that little hardened oil gland, and you take it out of the eye. And that's really the only way that you can treat what sounds like a chalazion, which is a hardened oil kind of bubble that's sometimes left over from an infection of the inside of the lid margin. All right, next question. I often get a feeling of irritation / pain, but only seems to be one eyelash. I pull it out with tweezers, and my normally dark lashes have a white base when I pull it out. Do I need lid scrubs? Happens once or twice a year, thank you. You may need lid scrubs. So the first thing that I ask myself clinically is, why is something like that happening or occurring on one specific lash? So if it's occurring on one specific lash, you may have an infection in that lash that's causing some type of alteration in the way that the lash is being formed and the way that it's coming out of that gland. And certainly treating that infection will make it better. The only challenge is we don't know if it's bacterial. We don't know if it's Demodex. So appropriately treating it is important, and your eye doctor will be able to tell you that. Now, there are scenarios where when you even pull that lash, it's just predisposed to be misdirected. So your gland actually is misshaped. And one of the treatments that we can do is we can actually freeze that small little hair orifice so that that eyelash doesn't keep growing in the wrong direction anymore. So again, lid scrubs may help, but we don't necessarily know the answer to that. And it's important for you to have that conversation with your eye doctor so that they can give you appropriate guidance on that. All right, next question here. I notice that my lids are turning inward now, and the lashes are irritating my eyes and lids. Can blepharitis cause this? The answer to that question is yes, it can potentially cause this. Any inflammation can cause the tissue to be altered. So for example, if you know anybody with arthritis that maybe can't bend their fingers all the way or can't straighten their fingers all the way, that's long-term inflammation that's caused changes to the tissue. And in that same vein, blepharitis can do the same thing. It can cause alterations in the tissue to force your lashes to move more towards your eyeball as opposed to face out. Sometimes this just happens over time with the loss of elasticity in the tissues in our skin. The good news is that if we treat the inflammation and it doesn't help it or doesn't fix it, oftentimes there's surgeries that can correct this. And it's a subtle little surgery that occurs that just pulls the lower or the upper lid down, whichever lid is actually causing the eyelashes to point towards the eye. So there are treatments or there are solutions for you with this. Great questions. So I think we've answered all of the questions here. I'm going to wait about another 15 to 20 seconds just to make sure that nobody else is pulling in questions or anything like that. I certainly do appreciate everybody's time and everybody sticking around here. This was a really great, I think the questions were so insightful, and I think it's good. I always, again, Larry, like you said earlier, I think your mission with this is so powerful, which is really empowering patients with more knowledge. I always feel that the more knowledge that patients have walking into the exam room, the better equipped they are to make the best decisions for their healthcare. Sometimes patients get nervous bringing things in from Google, bringing things in from the internet, and I always let them know that those things are encouraged in our office. Again, I am a strong proponent and advocate for the more the patient knows, the better questions they can ask, the more empowered they are to be the strongest advocate for their healthcare that they can. And hopefully this last hour and 15 minutes has given those of you on the call here a little bit more of that around the eyes, the surface of the eyes, how the eyes work, and specifically how inflammation works.